All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. Today we will do the second part of the inflammation, and that is the how do the white blood cells reach from the blood to the site of infection. This is called white blood cell recruitment or extravasation. Extravasation means that the cells come out of the blood vessels and go to the area of the tissue where there is damage or infection. So with this, let's start. So thank you very much and welcome everyone. Let's start. I'm going to share my screen. So here, if you see, what is going to happen is that this leukocyte here, leukocyte means a white blood cell. The cells to keep in mind, especially for us, are the neutrophils, monocytes, T lymphocytes, especially, for example, helper cells and cytotoxic T cells. B cells can be kept in mind as well, but mostly B cells try to stay away from the tissues. They like to live in the lymph nodes. T cells like to live there as well, but they can come over to the site of infection as well. So here is a white blood cell. This white blood cell is sitting on the arteriolar side. Arteriolar side means that this is the side of the arteries or where the blood is coming in towards the tissue. Then there is this area which is called capillary. Capillaries are the ends of the arteries and the beginning of the veins. These are small microscopic blood vessels. They are actually the one through which the nutrition to the tissue gets out of the capillaries, and then the waste products are brought back through the capillaries. So capillaries are thin-walled, actually single-cell-walled, and very thin and delicate things. For our today's action, what is important is that this leukocyte here is going to come out from the venule. So venular end is the other end of the blood vessel through which eventually the blood would go back to heart. So these vessels are called veins. So we're talking about the venular end. This is where the leukocyte would come out from. So keep in mind, leukocytes do not come out through the arteriolar end except in some specific areas. Leukocytes also do not come out from the capillaries except in the pulmonary tissue where they can come out of the capillaries. And most of the time, leukocytes would come out of the venular end. Now, remember one thing, that the veins and arteries, they have basement membrane around them. That means they're slightly thick. Arteries are actually even more thick than the veins because arteries have muscles around them as well. And then after the muscle, on top of all of that, so let's say these red things that are making our muscles, then on top of that, there is one more covering, and that is the basement membrane or the extracellular matrix. Basement membrane is right here outside the endothelium. The point is that arteriolar end is very thick. Blood vessel wall is thick. So coming out of this kind of a thick wall is difficult. Coming out of the venular wall is easy, but still we have to break this basement membrane as well to come out. So today we would discuss how does a leukocyte enter. And if you see here, let's say this is the tissue where the damage is occurring. So there's a coronavirus that is causing damage. The cell is broken. The other cells are healthy and fine. So we have to bring this leukocyte all the way over here so that it can do its function. So let's see how does this happen. First part of the process. When in some tissue, there is some damage. That damage may be because the tissue experienced an accidental stress, or that may be because there is infection. Whatever is the reason for the damage, what will happen is that the venular end, so I'm talking about the veins here, I'm talking about venular end, this part. Number one, what happens is that the venular cells the endothelial cells, they become contracted, they shrink. And how do they shrink? The local tissue damage releases some chemical substances. Important ones are leukotrienes. Remember, leukotrienes are the substances of inflammation. Then histamine, bradykinin, and we have been talking about bradykinin storm for some days. Bradykinin is also produced when the tissue is damaged. So when these chemical substances are present, they work on the venular ends of the blood vessels, and they cause these cells to shrink. When the endothelial cells shrink, that cause gaps to appear between them. Through these gaps, there are substances and fluids that can come out. So this is called increased permeability. So the permeability is increased, number one, by these substances. Number two, what happens is that tumor necrosis factor and interleukin 1. So in today's discussion, you would see that a lot of this mechanism is driven by the chemical substances that are released by the broken tissue, or then later on by the immune cells. So for example, tumor necrosis factor is released by macrophage, which is an immune cell. Similarly, interleukin 1 is also released by macrophages, which are immune cells too. So when the immune cells are there, and now they are also working and they're producing different cytokines, that would also cause cytoskeletal change in the cells and shrink the cell for longer period of time. So if you see here, this part, the cell over here with histamine and bradykinin, the cell shrunk for a few minutes. But when the cytoskeletal changes occur under the influence of tumor necrosis factor interleukin 1, then these changes start within 4 to 6 hours and they stay for 24 hours or more. So the cells would now stay shrunk, and the local area would continue to have more and more edema to develop. Then if you see here, another mechanism by which the blood vessels become opened up or permeable is when there is direct damage to the blood vessel. For example, coronavirus does that. And so this blood vessel cell, endothelial cell, is damaged and broken. And so, of course, there is a gap produced. Then the leukocytes, the lymphocytes and the neutrophils and the macrophages and monocytes, they can also release chemical substances which can in turn work on the blood vessels and make them permeable. Finally, it is also possible that blood vessels develop pores in them. So this is an endothelial cell. These are actually not two cells, these are one cells, but they have developed a tiny channel in them, which is called a transcytotic channel. And through this channel, material can get out. So the very first thing here to note, when the leukocyte wants to go to the site of infection, in that area of infection or tissue damage, the blood vessels have become permeable and the edema is occurring. Good. So that is first step. Now the second step. Imagine this, the whole of the rest of the lecture. Imagine if we are trying to land a plane. So the plane is flying in the air. The wheels are not open. And then finally the plane has to open the wheels. Then it has to touch the runway. Then it may bounce a few times. After that, it would become settled on the runway and finally it would stop. We have to do the same thing with the leukocytes, or let's say neutrophils or a lymphocyte. So if you see here, these blue ones are our neutrophils. The very first process, this is a blood vessel. This is a blood vessel. The very first thing that would now happen is something that is called margination and rolling. And if you are driving a car, you must have noticed when you want to exit a highway, if you are, let's say, in the middle lane or you're in the fast lane, you would bring your car all the way towards the right, well, at least in the US, towards the right, and then you'll take the exit, correct? Same is the situation here. These are blue ones, let's say they are leukocytes. The red ones are RBCs. What happens is that as the area of the infection causes the blood vessels to become permeable. And as the fluids come out of the blood vessel, the fluid inside the blood vessel becomes thick. So the hematocrit, we call it hematocrit. Hematocrit means the percentage of red blood cells in a given amount of blood. So when lots of fluids have come out, the density or relative density of the red blood cells increases in that area. Now, red blood cells are small. So what they do is they kind of push their way through the blood vessel in the center. And they would cause the other cells, the big fat white blood cells, they'll push them away and they will start marginating them. So the white cells will start becoming marginalized by the smaller and faster moving red blood cells. So it is like small kids running through the crowd and pushing the people away. So when these white blood cells, when they are pushed away, they will go and start touching the blood vessel wall. This process is called margination. Once the cells start, so let's say we focus on this one cell, the red blood cells have pushed it away, and now this cell is stuck to or is touching the blood vessel wall. What happens is on the blood vessels, there are tiny proteins. These proteins are going to start touching the white blood cell. This is, imagine if the plane, so when we had caused the margination, that means that the plane was coming out of the air and towards the runway, and the runway being the blood vessel cells, blood vessel wall cells. Once it touches the runway, it might start becoming slow, but it might still bounce there a few times. And that happens because when the cell touches the cell of the blood vessel, it kind of holds it transiently or weakly, and then it lets it go. And then it bounces on it again and tries to hold it once again. This process is called rolling. So if you see here, this is the white blood cell, and it is now rolling on the blood vessel, and it is kind of tumbling through it. And when it is rolling, the process of rolling means what? So there is a question. Lily says, paid member here, will we be able to see these lessons on the website? I missed the beginning. Yes, Lily. All of these lectures are edited and then uploaded on the website as well. So here, the process of rolling is this. So let's say this is an endothelial cell. The endothelial cells, under the influence of the cytokines, which are the products of the local tissue damage, they produce on their surfaces something that is called a selectin. Selectin is nothing but a protein. So imagine that the airport doesn't have a runway all the time, but when the plane has to come in, at that time the runway is exposed. So these P selectins and E selectins are proteins, or you can think of them as little arms that are protruded from the endothelial cells. These arms are not normally present, but they would start coming up and show up on the cell surface when there are infections or tissue damage nearby. So normally these arms are kept in tiny packets inside the cells. These are called Weibel plod bodies. These are nothing but, imagine if you have a tiny bag or a purse in which you have different things and you carry it around. So the endothelial cells have their own little tiny purses in which they keep things like P selectins and E selectins and so many other things. So when the tissue gets damaged, the local tissue produces, and the immune cells, they produces C5a. It is a complement. We have talked about complement in the past. Histamine, we just talked about it. Thrombin, we just talked that it would produce in some previous lectures. Tumor necrosis factor comes from the lymphocytes or the, what is that, macrophages. And then leukotriene B4 comes from as a product of inflammation. So all of this is really, these are these chemical substances released as a result of tissue damage or immune function. That in turn causes these tiny arms to appear on the endothelial cells. Now, the white blood cell also has tiny arms that are called sialyl Louis proteins. So these are actually small sugar molecules, and they connect together. So for the weak adhesion, we use lectins to kind of start to slow down the rolling white blood cell. So think about it. If when the plane lands on the runway, if you try to stop it immediately, the plane would break down. So you have to allow the plane to land, maybe bounce a few times and keep rolling on the runway for some time and slow down, and finally it would stop. That is what is happening. This plane has landed. We are now trying to slow it down by connecting with it and then breaking with it, connecting with it and breaking with it. So that connection and break is done through the proteins that are called lectins. So this is the process of rolling. Rolling would allow the white blood cell to slow down because it was zipping around in the blood system. Once it has slowed down enough, then the second part of the process is called adhesion. So now we want it to actually stop here. And what happens is, for adhesion, another set of proteins are used which are called integrins. Integrins, for example, on the endothelial cell, the integrins are called ICAM1. ICAM stands for intercellular adhesion molecule, or VCAM1, which stands for vascular cellular adhesion molecule. So simply they are called integrins. They are proteins. They would bind more tightly, and they are present on the endothelial surface and on the leukocyte as well. And it is a funny thing. On the leukocyte, the proteins or the integrins are called VLA4. These are called VLA4, or these are called LFA1 and MAC1. And here is a funny thing. Normally, if you see here these red dots that I made, these are these proteins that are spread all over the white blood cell. But when white blood cell wants to really stop, what it does is it collects them in patches like Velcro. It brings them all together on the side of the blood vessel. So when they all proteins come together and they become a cluster, they become a high affinity cluster. Now it can bind like Velcro on the other side with the endothelium. Right? So once that Velcro is connected, so imagine that on the endothelial side, there is a patch of Velcro, and then on the white blood cell, there is a patch of Velcro. And when they connect with each other, now they're tightly bound. So now the plane has stopped. But please remember, we would not try to do the adhesion without first rolling the white blood cell and trying to slow it down by slowly attaching and detaching with it, so it becomes slow down and stops. So finally, it has stopped. Now, why would it stop? The white blood cell brings its patch of Velcro, which is the high avidity patch, which is VLA4 protein and LFA1 and MAC1 protein for medicos here. This is done because of the chemokines present in the blood vessel system and around the blood vessel system for the infected or damaged, from the infected or damaged tissue or from the immune system. Remember, this all is happening in very tiny microscopic parts of the blood vessel, which are near the damaged tissue. So these chemokines are present there as well. Chemokines mean they are the chemical substances released by the blood vessels or the immune system or the damaged tissue, and they would cause chemotaxis. Chemotaxis mean movement of the blood cells, especially the immune cells, to the area of the infection or the damage. This is what chemokine means. And keep in mind, the leronlimab's action is on chemokine, correct? So chemokine 5 is on which the leronlimab would work. And what that would do is, if this is, so imagine this, chemokine is needed here to cause this adhesion. If the chemokines are not present, for example, leronlimab would block the chemokines, that would cause this adhesion not to occur. So even if the white blood cells come to the site of infection and they are in the blood vessels, they cannot come out. So the cytokine storms cannot occur. So anyways, this is the second process. After the rolling, we have adhesion. And this process is guided by the presence of chemokine, and then integrins are used to tightly bind the white blood cell to the vessel wall. Then what happens is, once it is the white blood cell has adhered to the vessel wall, it is now sticking there. Now we want it to get out. So imagine over here, this is the tissue destruction going on. So there is a coronavirus here that is wreaking havoc on these cells, and it is breaking them down and destroying them. These cells are crying and they're destroyed, and they are releasing these chemical substances which are called chemokines and cytokines. So this area is the area of bad action. So now we want this white blood cell, for example, a neutrophil or a T lymphocyte or a monocyte, to go out. So what happens is we have successfully stopped it. How have we stopped it? This is the selectin, for example, P-selectin or E-selectin, and this is the integrin. Now what happens is there is a new kind of protein structure that is extruded. Imagine that these things, the endothelial cell and the white blood cell, have arms. So they keep bringing in more and more arms to tightly bind together. So this new set of proteins, they are called PCAMs. PCAMs stand for platelet endothelial cell adhesion molecule. Again, they are nothing but proteins and molecules that are, or glycoproteins that are trying to bind two cells together. So here, when the PCAM have connected, then here is the interesting thing. Now the cell is actually going to change its behavior and get out of the blood vessel. This is called transmigration or diapedesis. Diapedesis means crawling of a cell towards the site of infection. So now this cell is going to start crawling from here. Have you seen movies where, let's say at the end of the movie, the villain is all injured and it's a robot and the legs are broken, but he's still crawling with one arm and still trying to go to the hero? So this is the same thing over here. Although this is the hero, what he's going to do is now this cell is going to extend its arms and then crawl by pulling through the arms and go to the area of infection. So the first duty of this cell, or the first challenge, is that it has to get out of the blood vessel. Now the problem is that to get out of the blood vessel, it has to pass through the cells and then the basement membrane, which is a collagen layer outside of the blood vessel. It has to open them and then get out. So here is what happens. The PCAMs have caused the binding. When this binding occurs with the PCAMs, then what happens is that this cell, the white blood cell, would release substances that would open up the intracellular junctions. So these are the junctions between the two endothelial cells. At the same time, it would release substances called collagenases. Collagenases are enzymes that would break the collagen, and that is what would cause this basement membrane to break down. Eventually, what it means is the cell is going to open up a door here, and then it's going to break this wall, and then it's going to leak out. This process is called emigration, or transmigration, or extravasation, or finally leukocyte recruitment. Now, it is also possible that instead of passing through the junction between the two cells, or the gap between the two cells, the cell here, let's say white blood cell, can actually pass through a cell. This is like if you see the movies where there is a ghost of someone and another person just passes through that ghost, or the ghost passes through the wall. So here, let's say that this cell is the endothelial cell, and this is the white blood cell. White blood cell has seen to open up holes inside the endothelial cell and then pass through that hole safely without destroying the endothelial cell. This passage is called transcellular passage, that is through the cell movement. And this passage is called paracellular passage, that is around the cell movement. So once the cell has come out, so let's say now the white blood cell is out here in the extracellular tissue. Now this cell needs to go to the area of destruction so that it can function there. And this is a very beautiful mechanism. Do you know what happens is these chemical substances that are present, of course, they are present in a higher density and higher concentration near the area of the broken tissue, because from that is where they're coming from. But as the distance increases, the amount and the concentration of the chemical substances becomes less. These are the chemokines. So the white blood cells have receptors for chemokines. And when those receptors attach with these lots of dots I've made over here, the chemical substances, what happens is the white blood cell can actually see on which side more concentration of the chemical substance is present. What it does is it opens calcium channels on that side, and it starts making microtubular structures. It starts making an arm of its own. We call it a pseudopod. It makes a pseudopod in that direction where the concentration of the chemical substance is more. And where the concentration of the chemical substances is less, for example, on this side, there what it does is it starts breaking down its own internal cytoskeleton. It breaks it down. So when it breaks it down, the skeleton, imagine if somebody's leg bones are broken down. So now that leg is going to start looking like a mush. That is what happens here, that this area becomes a mushy area because the skeleton of the cell is broken down here. And this area becomes stiff because new skeleton is formed here. Result is that the cell internally can now flow, the material in the cell can flow from that side to this side. And the end result is that this would keep happening. The cell would keep crawling towards the area of destruction, and finally it would reach there. And when it would reach there, it would start doing its function. So that is how this whole process is called leukocyte recruitment. The process of leukocyte to stop is rolling and then adhesion. First there is margination, then rolling, then adhesion. Then it comes out, that is transmigration. Then it walks, that is diapedesis or chemotaxis. And finally it reaches this place. Now the question is, what are these chemical substances? Just last few things and then we are done. What are these chemical substances? So some of these chemical substances that are chemokines, again, keep in mind leronlimab, keep in mind renties. Renties are chemokine as well. So here, if you see, if this was a bacterial infection, which is not the case with coronavirus, but we're talking about inflammation, bacteria sometimes release products that can act as a chemokine for our immune cells. For example, N-formyl methionine termini. Similarly, our cells, damaged tissue cell, stressed cells, and immune cells can also release chemical substances that would allow the white blood cells to be attracted to the area of damage. These are called chemokines. So why are they called chemokine? If you see here, chemotactic means chemical substance that would move something, and cytokine means a substance that has been released from a cell. So chemotactic cytokine, we take the word chemo from here and we take the word kine from here and we make the word chemokine. So chemokines are chemical substances released by a cell that would pull the cell to the area of infection or damage. So there is a comment here that what role do galactins play in movement? So look, very simple. Did we see here that for the rolling of a cell, so let's say here is a rolling of the cell is governed and processed by selectins. Selectins are called selectin because they have lectins in them. And lectins are those small, tiny sugar molecules. So this process of stopping a white blood cell in the area of the infection or damage is started by selectins or lectins. If we block lectins, then what would happen is that this rolling will not occur and the cells will not stop. It is a very similar mechanism, like the outcome is going to be very similar like leronlimab. For example, if you take selectin or lectin inhibitors, they would not let this happen. And when this will not happen, this is like plane that lands on the runway and keeps skidding on it, and it cannot stop, and then it flies back out. So here the plane came in, the lectins cannot connect, and the slowing down does not work, and the leukocyte is just going to take off again. So that is the function of the galectin inhibitors here. And this is the function of selectins or lectins to start the process of landing of a white blood cell. So now if I go back here, so chemokines, for example, RANTES and many other chemokines complement. Remember, we did a few days ago the discussion about the complement, the C5a, that is the breakdown product of the complement number 5. That is a very potent chemoattractant or chemokine. Lipoxygenase pathway products, for example, leukotriene B4. Where does this come from? Remember, we had one more discussion in case of aspirin. We did this, that in the cell membrane of a damaged cell or stressed cell or platelet, for example, the arachidonic acid pathway is activated, which would then cause either cyclooxygenase or lipoxygenase enzymes to become active, and eventually will make leukotrienes and prostaglandins and prostacyclines and so on. So leukotriene production at the area of inflammation is going to also cause, the leukotrienes are also going to cause the, chemotaxis. So all of these guys are the tissues crying things, chemical substances. Do you know that there are some cultures where when somebody dies, they ask people to come and cry? So there are, just like we have, for example, in the US, we have bands that go and play. There are, in some cultures, there are groups of people who would come on hiring, and they would come and sit down and cry. So these tissues over here, these chemotactic factors that are produced, they are like cry babies. They're going to sit here and cry and say, we are in trouble, we want more cells to come over. So that is it. That is the discussion. Some notes for today, and this is especially for medical students, nursing students, and others. Look, P and E selectin that are shown on the endothelial cells, they connect with neutrophils, monocytes, and lymphocytes. Selectins have the word lectin in them. They are for rolling. Similarly, glycam-1 are also on the endothelial cells. They connect with L-selectin on the white blood cells, and they are on neutrophils and monocytes. They are also for rolling of the cell. ICAM-1, VCAM-1 are integrins. Integrins are for stopping. That is when the plane actually comes to a complete halt. So ICAM-1 and VCAM-1 are present on neutrophil, monocyte, and lymphocyte, ICAM-1. VCAM-1 is present on eosinophils, monocyte, and lymphocyte, and they are integrins. CD31 is for transmigration. So that PCAM molecule that you saw up there, which allows the cell to start opening up the intracellular junctions, that is helped by CD31. And finally, the type of emigration, the cells that come out of blood vessels, what kind of cells are there? In the acute damage, that is, if there is an infection that happens and the very early response, or if tissue injury occurs, very early response is with neutrophils. So within minutes, neutrophils are going to come into that area. Then within 24 to 48 hours, within a day or two, monocyte and macrophages will come in. In case of bacteria, mostly neutrophils come in and do the function, their immune system response. In case of viruses, for example, coronavirus, the beginning is done by lymphocytes. T helper cells come over, and then the B cells are activated or cytotoxic T cells are formed. In allergies, eosinophils are the cells that come over to the area first. So this may not be very much interesting for non-medicos, but I know that medical students will have to learn this and they will have to cram it and figure it out. So I thought I'll put that in front of us as well. So this is what we have. This is the inflammation part 2. I hope you enjoyed it. It is a beautiful mechanism. At the end of the day, this is like landing a plane. Tomorrow is my off. We'll see each other on Monday. I did something. What I did was I took the long open forum discussion yesterday and I cut it up into smaller videos and put them up as well and put them in a playlist as well so that you can watch a specific question if you want it. So this is the discussion for today. Stay safe and healthy. Please like, subscribe, and share. That is the favor you can do to me and for others. And I'll see you on Monday. Bye-bye for now. Oh, actually, I want to show you something. Sorry. Let me show you one more thing before we go. So we have Nina. So Nina can't here, if you can see it. She drew a bunch of cool beans. So I wanted to show you those. So this is one cool bean. This is a chilling cool bean. This is another cool bean. This is Dr. Cool Bean. So this is Dr. Bean. This is another cool bean. This is the coolest bean, I think. And then there are so many other cool beans that are sitting here and chilling as well. So I thought these are pretty cute. So thank you, Nina, for making them. And once again, bye-bye and see you on Monday.